Alderneys Key FM.
From the top, as they say, the number of positive COVID-19 cases in Guernsey is 239. A total of 2,491 tests have been carried out across the bailiwick, and 2,212 have been negative. There have now, sadly, been 10 deaths due to COVID-19, one of which has been in hospital and is the comparable figure with the UK, which, as I've mentioned many, many times, it's only deaths in hospital that feature in the numbers which the UK publish every day for the sad loss of life. So we've only had then effectively one death which would be reported in the same way as in the UK. But we have had 4 deaths where COVID-19 was not the cause of death, but was a contributory factor. So the good news is that there are now 112 people who have recovered from the disease. There are no positive cases in Alderney, and people have been asking, well, exactly how many tests have we carried out here? And Dr. Sally has given those figures in the past, but just for the sake of completeness, I can tell you this morning that the medics have carried out 40 tests in Alderney since the virus appeared in the bailiwick, and all have been returned as negative. This means that just under 2% of our population have been tested, which compares to a testing rate of about 0.2% in the UK. And of course, although the population numbers are significantly different, nevertheless, this represents a really positive stand of testing people and being able to keep up with their symptoms. So that's a very, very good thing. So at the moment, there are currently 5 patients in hospital in Guernsey with COVID-19. None of them are in intensive care. 62% of positive cases in the bailiwick have been females, and only 38 have been male. Now that, if you look at the statistics generally, is bucking the trend, because it is found to, or men are more susceptible, it seems from the data, than women. But the reason that there is an imbalance here is that it reflects the fact that the virus has got into a number of care homes in Guernsey where the staff are predominantly female. So Dr. Brink feels that that is the factor which has shown that degree of variation. Now, for people who have access to the internet, the GovGG website has a community monitoring tool which invites people to sign up and voluntarily provide information about how they are feeling. Now, we already have some residents from Alderney who have signed up, among the almost 5,000 people who have done so. The importance of this is that Dr. Brink and her team, in assessing where we are and where we can go, need as much evidence as possible. And I've said many, many times, this is all about evidence, following the evidence and following the science. So the facility receives data from people who contact them and indicates that 6% of the people responding are self-isolating, either because they have returned to the bailiwick or because they have some flu-like symptoms. 13% of people are taking extra precautions in shielding themselves because they have underlying health problems which make them more vulnerable. 77% of the respondents are socially distancing outside of their own household. The remaining 4% include people like critical workers who may be unable to socially distance because of the work they do. The form which people fill in then asks them to indicate if they need further support, and almost 2/3 wanted information about financial support and 1/3 wanted to know about business support. Almost 1/5 wanted information about emotional or mental health support. This confirms what I think we all know, that for many people this is a very stressful experience. But by sharing that information, it allows those people who are responsible for keeping us safe to better prepare and to offer the services which people feel they need. So all that will be taken into account and worked with. So I think it is important for people in Alderney to fill in that online form if they are able to, so that we can ensure that it's an evidence base and we know what people are doing and how they are feeling. So it's an important tool in the armoury that is being used. Now, perhaps most of you heard Dr. Sally on the radio at 8:45 this morning, but just in case you didn't, I'll just highlight what she said. And that's people are not visiting the doctor or the hospital for the kind of reasons they normally would. So what Dr. Sally is concerned about is that we might have people here who have symptoms but are fearful of going to the doctors because of somehow exposing themselves to the virus, or not wanting to bother the health services when they are busy with COVID-19. And they are completely understandable emotions. However, we know and we are confident that the surgery is a safe space, and anybody who has visited the doctors since this began will have seen the steps that have been taken to ensure people's safety. The seating has been rearranged, social distancing is being respected, so please don't not visit the doctor because you fear that you might be exposing yourself. So all the staff are healthy, the doctors are all healthy, and so sometimes it's easy just to forget that with all the focus being around the virus, that we forget that people do get ill, and we forget that people do have heart attacks and do have strokes and do have a variety of different conditions. But what we don't want to do is to focus on protecting against the virus and somehow risk the health of the residents because for whatever reason they don't think that they should bother the doctor or they're frightened. So please, as far as, if one can ever call them, normal medical conditions are concerned, please go to the doctors. You will be safe, and it would be an awful thing if somebody didn't respond and give the doctors the opportunity of treating an illness as soon as possible with what might be very serious consequences. So please look after yourselves. The doctors are there. We have 3 healthy doctors. Dr. Cooper is at the surgery, and so please make full use of that facility. Ring up, make an appointment, and similarly, if you've been asked to attend a medical appointment in Guernsey, please go. We know that the only medical appointments that are being offered are ones for people who definitely and desperately need the treatment. So please, again, don't be put off. Look after your health and help the medics help you. So we're not going to get out of this situation anytime soon. So the facilities are there to help. Don't put off till tomorrow what you really in your heart know that you should deal with today. And yesterday, we told you that we were expecting some guidance about the business activities which might be permitted from Saturday under the first phase of transition from the current lockdown arrangements. Our understanding is that this guidance is likely to be released tomorrow on Wednesday. And of course, I will do my best to bring you all the salient points from that on Thursday when I speak to you. So we know that the civil service and the Committee for Health and Social Care are working tirelessly to provide the framework which will hopefully allow parts of our workforce to get back to work. So there will be lots of questions, I am sure, and I'm equally convinced that we won't have the answer to every one because, again, these sorts of decisions are made in real time, and so there will always be occasions when something wasn't thought about or something was thought about but doesn't seem to work. So the devil will be in the detail, but we will be working with Guernsey and working with the community to ensure that those people who can safely arrange to go back to work will be able to do so. So I know it's frustrating, but this time on Thursday, I should have sufficient news to allow whoever feels that the scheme applies to them to apply to Guernsey and get themselves back to work. So that, again, it's a positive, and it won't be perfect, but we'll work with it. Now, in Guernsey, they are doing media briefings now 3 times a week, and there was a media briefing yesterday, and that dealt with the future and the economic consequences of the crisis. And whilst we're all focusing at the moment on keeping people safe, we all know that in the background, our economies are faltering, and our politicians and our civil service are presently working around what the economic impact of this crisis will be. So I think it's important that we, as a community, understand the scale of this challenge. And so I propose to read extracts from Mr. St-Pierre's statement yesterday, because what happens in Guernsey will impact upon us. So I think it's really important that we understand where Guernsey is so that we can then better assess where we are in terms of the future. So what he said was this: at the beginning of this crisis, we were just dealing with a public health issue. We are now dealing with a public health crisis and an economic crisis. Whilst we don't know exactly how long the public health crisis will go on, depending on whether there is a second or even a third wave in the virus, the economic shock is severe, and we should all expect that recovery from the economic crisis will take longer than the public health crisis. At this stage, the full effect on the state's financial position is unknown and will be largely dependent on the timescale over which the public health measures continue, the speed at which we can restart the whole economy, and the speed at which the economy is then able to recover lost activity. But what we do know is that we are in a genuinely unprecedented situation. Based on current estimates, we believe we will have a requirement in 2020 alone to find 170 to 190 million pounds. This includes financial support schemes for businesses, a reduction in states' revenues across all revenue sources, increases in states' expenditure, and a reduction in states' operating income. ARINI's requirements, the provision of overdraft facilities for all our other trading assets who are managing their own cash flow requirements, and financing the state's cash flow as payments to the states are deferred. These estimates will increase if we have further waves of the virus or if we need to extend business support measures. For example, we said last week that there are some higher risk sectors, for example, pubs and clubs, which may be closed for some time, even while the rest of the economy has restarted. And as we also expect tight borders to continue for a considerable period, the travel and visitor economy is going to be particularly vulnerable. There is very likely to be an impact into 2021 and beyond as the recovery progresses. So we will be seeking the state's authority to use up to £100 million from the core investment fund, which is, in our terms, the rainy day fund. So that's money which has been put aside for just such an event, but of course nobody could ever have anticipated the scale. So there will be a paper which will be asking for the Policy and Finances Committee to be given the power to borrow up to £500 million Policy and Resources Committee to borrow up to £500 million in order to provide the liquidity to fund business support measures to replace income lost to service cash flow requirements and to make overdraft facilities available. I said a few weeks ago, and again this is Mr. St. Pierre, in relation to the public health crisis, we've got this. And I say again now in relation to the economic crisis, we've got this. Like the public health crisis, it's going to require swift, big, bold and courageous decisions, which is why we are going to the States this week. But just as we are managing our way through the public health crisis, so we will manage our way through the economic one too. Now, I've not talked about that because I want to frighten people about what the future might hold at a time when we are all extremely nervous about our health. But you can't separate the two issues. You have to look at health and the economic impacts as one. And therefore, I think it is important that we understand where Guernsey are, where they think they will be, and then consider the impact on ourselves. So, yes, there will be sacrifices we will have to make. There will be a change in the relationship, perhaps. But in the end, we will rebuild our economy. We will need support. But what we have got is a determination to take the same approach as the people who came back here in 1945 and saw the devastation facing them. They adjusted, they rolled their sleeves up, and they got on with the task in hand. And we will do the same. But what normal will look like in the future, nobody would be able to predict. So I say this only to give you a sense of how important these issues are. The figures are eye-watering, but that's the commitment of Guernsey states to ensure that after this has finished, the economy can reboot and we can all then make our contribution to get life back to as near to normal as we experience it now. So again, I think we can be very, very satisfied that Guernsey have this, and similarly, we will have this as well. So our politicians will look at the information which is provided, they will look at the options, they will make difficult decisions, but they will make those decisions on behalf of the community and with the support of the civil service and with expert report, experts there to offer their assistance, will find the blueprint for success in the future. So it's not negative, it's realistic. And I think that's what we have always said. We won't sugarcoat the pill. If things are bad, we'll say so. What we won't do is give false hope and encourage people to misunderstand the nature of the challenges. So that's the honest view. And having said that, it will be manageable. Now, one final thing for today, interestingly, again, this is information I only got very early this morning. A lot of you might already know about this, that there was a large-scale fire at the IMPO yesterday. Now, I've got a brief report here from Rich Phelan, which I think I'm going to read to you. It won't take long, but I think it demonstrates something which I'll come back to at the end. So Rich Phelan says, I received a phone call at approximately 16:50 by a member of the public who informed me that it looked as though there was a fire within the facility at the IMPO. I immediately went to inspect to establish the severity of the fire. Upon arrival, it was clear that the scrap wood pile was alight. Therefore, the Alderney Fire Brigade were immediately called. I also called David Jennings, who had been working down at the IMPO that day. By the time they arrived, the fire had spread to an adjacent container storing scrap fridges and freezers, and to the clean waste container, which was approximately 30 metres away from the wood pile. I had concerns for the safety of our hook lift vehicle and excavator, so they were moved to a safe area beyond the reach of the fire. Fire crews arrived and immediately began to tackle the blaze. It was soon apparent that they would require support, and therefore the airport fire service were called upon. Working together, both brigades managed to contain the blaze before having to stop due to restricted visibility of nightfall. There was a strong east-northeasterly wind which exasperated the fire and made it impossible to extinguish fully. However, crews managed to successfully fully contain the fires prior to returning to station. At approximately 23:50, I received 2 phone calls, one being from a member of the public and one from Guernsey Police. Both calls informed me that the flames could be seen from afar and that there were concerns about the safety of the surrounding area. I returned to the IMPO to inspect, and although the flames were large, they were still contained within the woodpile area. I telephoned Guernsey Police and Mulgodian to inform them that the fire was still contained and that there was no need for the intervention of the fire brigade. I remained close by for 1.5 hours to assure that the fire didn't spread any further before returning home. I have been to inspect 2 further times overnight, and although the fire continues to burn, there is currently no risk to it spreading any further. So that was, and I mention it because that's a classic example of how well our emergency services are prepared and integrated. So that's the sort of professional response which will stand us in very, very good stead should our emergency services be tested as we go along the road towards the life becoming something like normal again. So I think, again, we can all take great comfort. Rich Phelan obviously spent most of the night monitoring this, so I think we owe him a big vote of thanks for that. But it's just a small example of when we have an integrated system, it responds quickly, it responds effectively, and it ensures public safety. So that, I think, is that. And I've got a couple of things I will talk to you about tomorrow, which will be the upcoming States meeting in May and also the Helping Hand Appeal, which I have started, and I think we'll be going live, or more live than we are now, with it tomorrow. So I think that covers everything, unless, Dougal, you have anything.
No, thank you very much, William. Just to say, well done to all those heroes out there, because there are a lot of heroes around Alderney at the moment, and I just think we're finding out by the hour how many there actually are. And so thank you very much, and we look forward to speaking to you again tomorrow. Just going on a lighter moment, the dance, we've done our dance this morning, which you will probably be able to see. So I think after that, William, you're going to be safe. And the next thing is we've had a request.
Yes, we have from, this is the ladies and Dr. Cooper calling from the IMC. They want something uplifting, an uplifting and rollicking song. And one of the ones that they wanted was Proud Mary, Tina Turner's. So,
and which we'll do any second.
Well, let's hope you've got a
little message,
a challenge for them.
A little challenge for both the surgery and also for the hospital. If any of you are listening down the hospital, or indeed any of the emergency services, as you know, we're doing our dance theme every day at 9 o'clock or just after 9. Well, I'm going to give you advance warning that the song tomorrow, just after 9 o'clock, will be Dancing Queen from ABBA. Now, I defy anybody not to dance to ABBA. So for the IMC and also the hospital and anyone else in the service, in fact, public works and anything like that, if you're all working, why don't you at 9 o'clock and film it all, and then we can get it on Facebook. What do you think about that, William?
I think that's a great idea, Dougal. I think I've had some very positive feedback from some of my lady fans, and certainly raised my profile a bit. But, you know, for those who remember the fashion show, well, you know, it's just more of the same. One thing I forgot to mention, Dougal, before I go, there'll be an emergency services exercise taking place this morning. So if you see the emergency services, nothing to worry about, just part and parcel of the processes they go through to make sure they're ready to meet the challenge if it arises. So I shall now go and I shall have a look at you and the Magster, because you were a little bit perky this morning. I did notice earlier on. So you were looking forward to this.
Yeah, I soon got rid of that perkiness, let me tell you. But William, thank you very much, and we'll be speaking to you again tomorrow.
All right, thanks everybody, and stay safe.
Yep, stay safe yourself. Bye for now.
Alderney's Key FM.